I'm really excited about our Lunch and Learn guest today. I had the good fortune of meeting Tim Kuhn several years ago when I first started teaching at UT. Tim was working at that point in time with the Knox Planning Commission and helping a lot with zoning and all sorts of other cool things that the city and the county were working on in terms of kind of thinking about urban planning. And we got to actually develop a couple of labs together at the time where we actually got to incorporate projects that Tim's team was working on that my students got to contribute to. And it was a really great experience. And since that time, Tim has actually gone on and he's now working directly for UT. He's actually the director of the Tennessee State Data Center, which is here located at UT's campus. And in this role, Tim gets to do a lot of really cool data and not always GIS, but very data focused things. So if you've got any interests in demographic trends or things related to the census, if you've got questions about who's moving into the state, who's moving out of the state, what are the economic forecasts that people are making for the state, Tim is deeply involved in all these different processes. And while all those things are very cool on their own, one of the things that I'm most impressed with what Tim does is Tim makes the best dashboards I've ever seen. So the dashboards that you all were exploring earlier, Tim taught me how to make those. So everything that's good about them came from Tim, and anything that's bad is my limitation. And Tim has been working for the last year on COVID-19 related data collection and data visualizations. And even though this is not a COVID-19 focused academy, it's still a disease, it's still data visualization heavy. And so I asked him to come in and talk about his experience sort of at a high level with data visualization, dashboards, story maps, basically you can kind of run free with it. So Tim, thanks for joining us, man. We really appreciate you being here and taking time out of your Saturday.
Yeah, I'm excited to be here. Appreciate you guys giving me a chance to talk to everybody. Always good to have a crowd interested in GIS and data viz and those sorts of things. So when we get a chance to talk about it a little bit, it's always a pleasure. Let's see, I need to do the share, right? Let's do that. Just do that. Okay, slide that over here. And I'll move this, yeah. Sometimes I still get confused with all this Zoom stuff, even though we're almost a year into all these sorts of things. So give me a shout if anything's looking wonky. I'm going to leave the PowerPoint screen up here, and we'll just be we'll be using that. We'll be using some we'll go live and look at some things when it's appropriate. So we're just going to be flipping back and forth, and hopefully you can still see me on the camera. We can still see still see me, because I get kind of tired of just staring at the screen here. So we're gonna, I'm gonna start off, basically gonna do two things. One is introduce you a little bit to the State Data Center and tell you about the work that we do very briefly, and just give you a few examples so you can kind of get an idea through those examples of how we're using data to communicate information about the state and why it is we're even doing that in the first place. And then we'll, like Michael said, we'll just kind of use the COVID stuff to talk through that project, how that came about, and some of the lessons that I've learned over the last, it is almost a year now. March 5th, I think March 6th was Tennessee's first case. Of course, it's all been on our minds longer than that, but so it has been a useful vehicle to learn about data visualization, to learn about frequent data updates, to learn about managing an increasingly large set of information. So we'll talk about that process as well. And we will just be, I'm open to questions at any time. I don't know if they come in via the chat and you want to handle, Michael, or if people want to interject, however you want to do it, I'm up for it. So let's start off. State of Tennessee is our partnership with the State Data Center along with the U.S. Census Bureau. The state provides the funding for us, but the Census Bureau is kind of the impetus for the formation of the state data centers. And there is, it's a state data centers are actually, they're in all 50 states and 6 territories of the United States. And it's it kind of started out as something, when you think about what a data center is, it's a computer place where you provide information. That actually was what it used to be. And so a lot of data centers were housed at universities because they had a lot of computing power back when things were on tapes and that sort of stuff. But obviously the internet has changed our need to be able to provide that service. So the Census Bureau can deliver all the information they need now. People need to no longer go into libraries to look at giant volumes of books about census data. They can get it online. So that means that the role of what the state data center does has had to change. And so not only we still provide data, we still analyze it and reproduce it and help people get access to it. But we also provide training about how to do that. We provide technical assistance when people have questions about when they're looking for data. And we also work with the Census Bureau a lot on various types of projects, whether it's the 2020 census, whether it's providing, through another role, we provide a lot of information for the population estimates that are produced for the country each year. And we also work with them on things that they're doing, their new products, new software, and those sorts of things. So we get a ton of support from the Census Bureau to learn about what they're up to. We do a lot of things to help take that information and carry that message down to the state level and use that opportunity to make it relevant to data users in Tennessee. And that is our key. That is what we are really ultimately all about, is taking these things that are happening at the national level, making them relevant to government agencies, academic research, individual citizens. And coming from, I worked in, Michael mentioned I worked in planning. So I worked in planning for Knox County for almost 18 years, really working in GIS and communicating out to the public things that we were doing in planning. I worked in another agency for 4 years prior to that, but I've always worked at like the county level. And so I'm always I'm very keen to the needs of the information that county level individuals need. And that's a lot of, in city level, that's a lot of the data requests that we have, is helping those types of agencies work with information. So it's a very practically focused sort of delivery of information that I think that comes from having worked in local government for so long. So that's a little bit about what the State Data Center does. And I thought what I would do here is just use 3 examples, talk through 3 quick examples to show you some of the things that we do to help explain the situation and share data. So the first one is a product that actually started coming out in March, or maybe it was early April, when a lot of the economic issues related to the COVID-19 pandemic started. Let's look at this slide right here. What this slide shows is just the impact of the jobs, the loss of jobs that primarily we saw in April. And when that happened, obviously there was a great deal of concern about what the economy was going to do. The State Data Center is actually housed at the Boyd Center for Business and Economic Research, which is part of Haslam Business College. And I work with a lot of economists. I think they, in fact, are all economists for the most part. And so I have an economics minor, but that doesn't really help me at the level that they're talking. So they work with a lot of data about the Tennessee economy, but we're good at visualizing it, right? So we take, creating, in this instance, a chart of small multiples showing the drop and loss of jobs in April, and that slow rebound back to almost pre-pandemic levels at this point. Coming from that county focus and that GIS background, this is a map that shows the change in the local option sales tax revenue for counties. And I just want to point you to this bottom map here and explain to you what this map shows. So what this map shows is a comparison from 1 year ago, what the county level revenues were. And so the counties that are shown in, it's gray, but it looks kind of tan, I think, tan in the lighter, the darker shades of green. Those are areas of the state where revenues are above where they were a year ago. So that means through the course of this pandemic, a lot of local governments have seen tremendous increases in the revenues that they're collecting, because the number of people that kind of shut down the use of services, whether it's haircuts or pet grooming or things like that, people were just staying home, and instead are focused more on buying. They're buying their own hair clippers and they're washing their dog. So the use of services went down, but that was offset by a tremendous increase in retail spending. And that's important for, in the case of Tennessee, local governments haven't felt the pinch that they have in other parts of the country because we're so dependent on sales tax revenue here. But this is the type of thing where a map can communicate that situation to state officials. And I think this was particularly influential in them understanding that's what had happened. Another sort of piece of information that we work with a lot of demographic information about the state's population, a lot of it about the population trends, the components that are driving the change in those trends. And so this is an example of a story that I put up on our website a couple of weeks ago, and it's explaining information about birth trends in the state. And I think this is actually science. I don't think it's social science or demography. This is science. I think this is relevant for your classes, actually. But what this shows is that in the state of Tennessee, the number of births between 1995 and 2019, and it's pretty interesting because the number of births is more or less flat and has remained at about 80,000 for the better part of at least 10 years. And it was, and that's in spite of the state growing by, in the last decade, 500,000 people. So what that helps us understand is that the birth rate in Tennessee is going down. The number, it's a combination of a number of things. One is that there are more older people living in the state, but the other thing is the decline in what's called the fertility rate. So this is the number of births to females aged 15 to 44 per 1,000. So as you can see, fertility is is falling, it's going down over time. Fewer children are being born. That's primarily because there are women between 15 and 30, there's just fewer births to that age group, and it's not being offset by the increases in the older age groups. So we try to use an article like this to kind of explain that situation and help them understand, help people just understand that they're interested in this topic. A third example is a product that we produce at the Boyd Center, and this is the state's population projections. I think we are pretty much the only provider of population projections for the state of Tennessee, and we provide it at the county level. So this, again, this is a dashboard. This is Esri's ArcGIS dashboards. That's where this is built on, but the data is produced by one of the faculty in our center. And what it lets you do, we'll just scroll down to Knox County. A lot of my dashboards are set up this way, so you'll see this a lot. You'll scroll down to Knox County and you click on it, and it'll zoom into Knox County. It'll tell me that the population in 2018 was 465,000 people. By 2040, that number is expected to grow to almost 550,000. And then I get a few indicators. So the working age population is currently at 60.2% of the population is of working age. You said the state's population is tending to get a little bit older. If we click on that, we'll see that it's going to drop to 56.1%. So there'll be fewer, as a percentage of the population, there'll be fewer people that are of working age in Knox County. So this is not only does this showcase kind of a bit of information that our center produces and highlights it, but it also gives a way for people to quickly see something that's not in a spreadsheet, but to actually visualize it and be able to see that trend for an area over time with just a click. It's just a click is all it takes. So one click to data is one of the things that I think makes dashboards great. Another thing, I said we work a lot with census information. The U.S. Census, of course, we're waiting for that data to become out. That data was collected between March and October, late October this last year. One of the things that we did is we tracked that response very closely. We try to communicate the number of people that haven't responded. And the one reason I wanted to keep this in here is that I think when you think about the census, a lot of times you think about the census as being just information about people, the number of people, how old they are, their race, their ethnicity, maybe their income and things like that. But there are other things in the census that might be interesting and relevant to the work that you do as related to science teachers. So one of the things that's collected in a product called the American Community Survey is information about the occupation of people in the country. And in this case, what I'm showing is occupation by sex for the civilian population 16 years and older. And I'm showing it for the state of Tennessee, and it provides us information about the number of people as males, females, and then the percent male and female. And there are many that are shown inside this interface or inside this table here. I've got the ones that are just kind of STEM related here. So there are 73,000 people working in computer and mathematical operations in the state. There are 26,000 people working in life, physical, and social science occupations. So maybe as it's related to some sort of STEM occupations, you could go in and use census information to go and see this at the state level. You can see it at a county or regional level. You can also look at it over time too. So in 2000, we can look at 2019, but we can scroll down and change the year to look at this data in 2010, make comparisons, maybe even want to build a chart off this. That's certainly something you can do. You can download all this information and use it as you see fit. All right, so that's about us. If you want to keep in touch with us, follow us on Twitter or on Facebook. Also go to our website and sign up to our bi-monthly newsletter, which every 2 months we'll send out some of these kinds of updates that have this sort of data in it. Might be something that you enjoy hearing about. I put this in here because we often breeze through it at the end. So now you've got it up there and you can think about going to sign up for that. Okay. Do we want to pause? Is there any questions or anything like that? If not, we'll keep rolling.
Yeah, I've been putting a few links in as you've been going for resources where I know where those are at. Okay. And anything you need from me afterwards, I'll share those with you. Okay, so COVID-19 dashboards. Yeah, we're coming up. I know I was thinking about looking at COVID-19. This thing started coming out in January of last year, where I started getting a little bit concerned about what was happening. Tennessee's first case was in early March, so we're coming up with almost a year of this. Move my things around a little bit here. So we created a dashboard. We created this dashboard. We went live with it on March 26th of last year. And thinking back about what I was seeing in January, is that I was looking at dashboards that were coming out of Asia, and in particular the one that everyone saw coming out of Johns Hopkins, who's kind of the greatest dashboard, is like 1 billion views or something just absolutely ridiculous. But I'm looking at that, and I'm seeing people creating dashboards with our GIS dashboards, and I'm saying that's the same software I use. I know how to use that dashboard. I know how to make it sing. I know the data formats. I've messed up on it enough times to know what we shouldn't do. And so I began thinking about that a little bit. I think the first case was in early March. I think I was tracking it in spreadsheets by the second week of March. By the third week of March, by March 21st, I had a data schema and a functional dashboard in place, and sent it to my boss and said, "Yeah, we're gonna put this thing up. What do you think? Are you okay with that?" And he said, "Go for it." And so we put that out. And when I first started doing it, I really think that I thought of it as kind of a therapeutic sort of thing for me, where it was just like, I felt like I had an opportunity to help and to help convey some information in a way that was being done elsewhere. And there was no reason why the state of Tennessee couldn't be a leader in trying to get some information like this out. And I would just, thinking back about, just kind of plugging the GIS profession a little bit here. I think that GIS people have two things that is probably we all have in common. One is that we know data, and we know how to manipulate and develop data quickly, and we know how to get it out there for people to be able to consume. And I think if you go back and look at all the dashboards, if you were to kind of see what the early information that was coming out,
a lot of it was coming out of GIS shops. It wasn't coming out of public, I don't mind this on public health, but I mean, it wasn't coming out of public health. It wasn't coming out of IT shops and things like that. It was coming out of GIS folks. In fact, I meant to show this just as an intro. I got a great kick out of looking at the Mars stuff that came out the other day. I don't know if anybody saw this tweet, but over here on the right, as the Mars lander touched down, there's ArcMap right over there, Esri's ArcMap, up on the screen inside JPL. And, so GIS is kind of ubiquitous, and it's kind of always at the center of things in my mind. But that's one of the things that GIS can do. It's like it knows how to convey, we know how to convey the situation as GIS professionals. And so I think that's one of the reasons why we were so quick to come into market with things. The other thing is that I think GIS people generally, they like to help. Because they're solution oriented. We see that this is, when we see a problem, we know we can help convey information that can help alleviate that problem, or it can help people tackle a problem or something like that. So those are the two reasons that I think, I kind of took on this project, even though it's probably not kind of part of the sort of public health sort of realm that we don't work in that area too much. The other thing I think that's really interesting is that there's been an incredible evolution in terms of the expectations around data and delivering information very fast. And what this shows is the use of the search term dashboard in Google. And you can look at the 5 years leading up to January, it's very flat. But then beginning in January, we see this spike, and it's waned a little bit. But just that the idea and the prevalence of dashboard types of information has spiked because of this. Now, we were already using it beforehand, but the expectation that that kind of information just be available at the tips of your fingers, updated and on a daily basis, that there is data infrastructure to support them. This has all happened really quick with the COVID-19 pandemic, and it's driven this surge. And it will be interesting to see if the expectation is there for other types of incidents or projects or whatever it is. But I do think that it has changed things to some degree. Now we went live in early March with a dashboard that was very simple. It's very quaint. Look at that, 784 cases. Just for reference now, February 20th, we're at 762,000 cases. So that's a pretty big increase in terms of the order of magnitude. But we'll show you what that dashboard looks like here in a second. Our dashboard's not been static. The thing that's been really interesting about the COVID-19 pandemic is that the information that people needed to know has changed. And some of the information that we probably put out initially was absolutely wrong. We took a very economics sort of centered view of the information that we put out. And one of them that's down here is we put down the percent change in new cases. Economists, it's just like seeing percent change year over year. That's a very valuable and typical sort of thing to want to do. If you put out the percent change in the number of new cases relative to the total number of cases, even as the number of new cases goes up, the percentage goes down. So it's always going to be decreasing. And so some of the epidemiologists pointed that out to us, and they're like, you've got to take that off. That is absolutely wrong. You shouldn't be showing that. Another thing that's evolved is information about test positivity, the number of tests that are positive. I don't know that this was really out there before the pandemic began, but it emerged as one of the things that people needed to be able to track. And so we're able to adapt to that, add new tables, change our design, and put that sort of information into it. Another one change that we've heard is active cases. We track the number of active cases. If you talk to someone in public health, that idea didn't exist before COVID-19. But somehow along the way, as this went on, the number of information about the cases that were active became relevant. And so it's an indicator that we track. So this information hasn't been static. It's evolved throughout the course of time. So we get the data from the Tennessee Department of Health. They provide daily updates every day between 3 and 5 p.m. or so. And I think what's been really interesting about the approach to the information that's been released about COVID-19 is that as it's gone on, it's almost become overwhelming, the amount of data that's out there. It's never gotten less. It's always gotten more. We get more and more and more information, not just more rows, but more data. They're including more information. So, and now it's expanded to include information about vaccination. And so, and it's a really, I think, tremendous level of transparency and that they are getting by providing all this. Well, they're being very transparent about the information, but I think they're getting some good things as a result. People can build their own tools. County level people can do things with it. I know people at Oak Ridge download the data that we post every single day so that they can have an idea of the situation as a large employer. So there's a lot of things that can come of adopting this open data model that you share the information. And this is the expectation that there is for lots of types of information, not just this public health data, but whether it's parcel information or road information or topography information. You know, there's just this idea now that data is going to be there for people when you go to get it. The State Data Center, we're absolutely committed to that. Our population projections are open. Our dashboards and things like that, you can save a copy of it yourself and take it and do your own. So we're absolutely committed to openness as well. But I do have to compliment the state on their absolute commitment to doing this. We talked about that a little bit. Let's just go look at the dashboard now here. Okay, so you can get to the dashboard from our website, tnsdc.utk.edu. And as you can see, it's set up similar to the other one I showed you, where the list of counties is over here on the left-hand side. And to get it to work, so we'll just click on Knox County. You click that, it'll zoom into the county, and it'll show us information about just Knox County. Over here on the bottom, we have the number of new cases for the county, and you can see it fluctuates quite a bit every single day. And we have a second, you see a second line that's integrated here, and we're getting that through, it's called the UTK COVID-19 Nowcast. The Nowcast is produced by some faculty in the geography department and research at Oak Ridge. So the Dr. Nicholas Nagel there at the geography department at UTK is one of the co-authors on this model. They provide us a daily update to produce this trend line. It's a very intense curve fitting algorithm where they produce this trend, these numbers for the entire country every single day. And it runs, it runs for a long time on a big server sitting in his office. But what it does is it helps you understand kind of more in real time what the current trend is, in a way that is more statistically accurate than using like 7 or 14-day averages. So it's particularly useful in something like in small counties. That's really what it's designed for, is where areas where there's not a lot of population. This is just Coffee County. But particularly back in the early parts of the pandemic, when the cases were quite a bit smaller, there's a great deal of fluctuation. The understanding wasn't all that clear about what was going on. The Nowcast really is designed to pick its way through it. It borrows from other counties around it to try to develop a trend. So it's been a really neat tool. It's something it's absolutely unique to what we're providing here through the COVID-19 case tracking dashboard. Here's the active cases graph that I mentioned. You can see active cases that are starting to fall now back to where they were almost in early July. So there's been a tremendous drop in the number of new cases as it relates to COVID-19. And the other thing two other things I wanted to show you on here. One is, here's that test positivity chart. This sort of thing, of course, at the beginning wasn't viewed as something that was important, but now it is. Since you're all teachers, I think one of the things that's really interesting is the different sorts of expectations around the country about test positivity and what it means. I listened to a podcast about up in New York in their city school system. Their city school system could be in person until it hit a 3% positivity. So of course, in the state of Tennessee, our positivity for the entire range of the pandemic is over 11%. So there never would have been in-person school if we had adopted such a standard here. So different takes across the state. Test positivity has gone down quite a bit. It was up around 20%. It's currently down around 8%. We have on the front end here, we have kind of the leading indicators, the things that just tell us what the current trends are. But on the back end, we have these lagging indicators, which are the ones that show us what kind of things that follow the trend later. So one of the things that people are discussing a lot now is like, are cases really falling? Are cases really going down as much as they appear to be? And the answer, by looking at the lagging indicators, the answer appears to be yes. In early January, the number of new hospitalizations in a week was up around 600. That was really high. It's now down to about half of where it was, and it's been on a steady downward trend. If you look at the last week versus the week before, it was 405 the week before. This week, it was 266. The number of deaths is also on a downward trend on a daily basis. And another model that we use to help understand that trend and see what's driving it is something called the transmission rate. This is a model that's produced by Dr. Liam Tran, who's also a faculty member in the geography department. What this shows is the number of people that are infected by one person who is infected. So if the R, you hear this called the transmission rate, or R, and in this case, if R is 1, that means every person that gets infected infects one other person on average. So if R is above 1, the number of cases are growing. So for the state as a whole, back in mid-December, R had reached almost 1.2. So the number of cases grew dramatically, almost exponentially. And currently now R has been tracking below 1 for almost a month straight. You hear a lot of talk about the COVID-19 variants and things that UK variant and other sorts of things. What has people concerned is that the transmission of those is quite a bit higher, the transmission rates. I saw a number that said the transmission rate of the UK variant was like at 1.5 or 1.6. And so that's why people are very concerned about these variants. If you see what the exponential growth looked like when it was 1.2, imagine what it would be like if that became widespread and jumped to like 1.5 or 1.6. So that's kind of the basis for the concern. So that's a good bit of information about our dashboards. And I thought I would kind of close by talking a little bit about what I think have been some of the key challenges and differences that we've learned. Well, actually, I'll pause and see if you have any questions or anything that's specific to COVID-19 data or anything about that dashboard.
And so, Tim, I know you and I have talked a little bit about this in other conversations. There have been some weird things that have happened with the data over time that's come from the state. Can you just address a couple of those like weird little hiccups that happened along the way?
I think we're in a hiccup right now, actually. You know, this right here, there's like if we look at like what's happening right now, there's like this weird double whammy that's going on. First is the state had there's always oddness in this data, and it can confuse the trend. Right now, the state had a backlog of 25,000 cases that hadn't been assigned to counties. And they were going through here at the beginning of the last week and a half or so and assigning them to counties. And so the number of new cases looks like it's going down when in fact they're just kind of cases have been sitting and pending. And then on top of that, look at West Tennessee here over the last week or the last few days, and look at just the number of cases. There's nothing coming in. I think that's because all the health departments are shut down. And that's starting to show up in the transmission rates over here. It looks like there's nothing going on. So that's kind of that's kind of like one of the weirdness and sort of oddities that come through in this information. You know, another thing is that we track the information as the number of new cases as is reported by the health department when the new case is reported. There's other data that has information about, for instance, when the first symptoms were reported. But information like that is confusing because it's revised. You know, the number of cases where the symptoms were reported yesterday might be 50 today. It might be 50. By tomorrow, that might be 100. By the next day, that might be 500. And so there is a lot of nuance to understanding this data. And the real challenge in doing a dashboard is keeping it simple and making it so that people can understand the nuances of the data without making it incorrect, without introducing errors. So I don't know if that answers your question, Michael, but there's a lot that goes on, and we get a lot of questions and feedback from people about the data, even though we're not the provider.
Yeah, so what I'm thinking about with our teachers and with our megabytes data is that, you know, we've got, like you've talked about, we've got, you know, a couple dozen columns worth of data in our tables, and some of that may not be obvious. So like the term embryonating, if we were to use the term embryonating in our dashboard, no one outside of Becky would know what that means. So I'm just thinking about ways we need to think about if we want to communicate our megabytes results data using this tool, what are some things we need to be thinking about in terms of this idea of, you know, the nuance in the data? You know, can you tell them a little bit about what happened? I think it was in June where all of a sudden we didn't have any cases in Tennessee. Do you remember that day?
Was that a day when there was just nothing reported? Was it? There were some days where we just had no, sorry. There were some days where we did just have no data because of just some processing issues that the state was having. You know, a system broke in the middle of the night, and you know there were new cases, and that was like the first time that happened, and people's minds were blown. But you know, what's interesting is they've adapted how they handle that. They just reported new cases, reported double the next day, and it was like, well, that threw things off. Now it's like if there's a system processing issue where they aren't able to report new cases, they provide data for 2 different days. You know, and it's like now we were able to maintain that good situational understanding by them providing data for both days rather than just slamming it all into one. So there are things like that happen. And I feel for the folks at the Department of Health because they have worked nonstop every single day for the last year in providing this information, and they've had to adapt and change now to focus on the delivery of vaccines. It's tremendous the amount of it. If you go look at their website, it's tremendous in the amount of information that they're putting out. It's amazing, and it's all been stood up very kind of quickly and on the fly. So. I'll just close out with the last, kind of along those lines, like what you were just mentioning in terms of jargon and things that other people might not be able to understand. And I think there's a couple key points that I like to emphasize in terms of dashboard design and that sort of thing. The first is that differentiating between data and then intelligence and insight. And you know, data is information is something just like the number of cases that, you know, when we first put this out, we were putting out information about the total number of confirmed cases. And it's like, is that really useful? That doesn't tell you anything about the current situation. That'd be like telling people like the total number of people who have had flu. At some point that number is meaningless. And so you have to think about ways to try to tease out important indicators and really emphasize those inside your dashboard. For us, you know, it was things like focusing on the development of the positivity rate, making sure that was something that people could see. We based on a lot of input from people in the field of epidemiology and public health, focused on the number of new cases as being like the leading indicator that we really wanted to focus on and convey to people. So we put it top right, we put it front and center. New cases is the thing that we are really trying to emphasize. That's what you see when you get here. Another thing is to simplify. And this is a guy, this is the author of The Little Prince. He was an airplane pilot. I love this quote because what it says is perfection is achieved not when there is nothing more to add, but when nothing is left to take away. And this quote is from him describing the beauty and simplicity of an airplane. It only has one job, especially back when he was flying them in the 1920s and 1930s. It didn't have any extra pieces. It only had the minimum amount of information that it needed to be able to do what it was supposed to do. And I think dashboards are along those same lines. They should be really small. They should be focused on simple applications. You should try to minimize words like what? I don't know what that word was. I don't know what that word is. And in a dashboard, there's not room to convey it. So you have to be a ruthless editor of the information that you're putting out, and really just try to simplify and ask yourself if you're able to get the point across without showing absolutely everything that you have. As impressive as it is, you have to edit. And what I would say is that's just to kind of close out. One of the things that Michael and I had also talked about leading up to this was the difference between a dashboard and a story map. And I think the key thing to understand is that dashboards are about providing situational awareness. They're about providing key indicators and showing a key point of information that people can track on a daily basis. Whereas something like a story map is where you use information along with some sort of interactive maps to explain something and lead people to a conclusion. So one of the things that we had done is we just played with some census information from over about a 20-year period for Nashville and Davidson County. And this is looking at housing vacancy inside Davidson County and understanding how it's changed. And we put some paragraphs and text and stories that describe what happened over the course of that period. So we reached the conclusion that the vacancy rate fell by 0.8%, but overall, half of the census tracts in the county increased in vacancy and half of the census tracts decreased in vacancy. And then we can put an interactive map in there so that people can go in and explore this and then try to understand what's gone on, but on an individual tract level basis if they can. So I think the story maps are really important in terms of explaining something to someone, whereas the dashboards are more focused on situational awareness and an understanding of what's going on across a variety of areas, and you can be able to access a lot of information very quickly. So, and that's it. So there's my contact information. Anyone, you like everyone else in Tennessee are welcome to call anytime you have questions about census data, economic data, public data that's out there about the state. Happy to help. And if there are any questions, hopefully we have a few minutes to talk about them now.
Got a question, Tim. So Tim, first, thank you for coming. It's so weird to clap without somebody like in the room because I just sound like a clapping. I don't know. So I'm Becky Trout-Frixell. I work with mosquitoes and I'm the entomologist here in the project. In your experience, moving from working with economists to the health departments, how easy was it for you to build the trust that way? I don't know if that question is clear enough. Like them giving you data sets to visualize and then trusting you and your data sets that you developed, your dashboards and models.
That's interesting because, well, even like Liam and Nicholas, who developed the nowcast and the transmission rates, are in the geography department, and they're not in public health. The state health department leaned on their GIS group in STS Strategic Technology Solutions, GIS group, to develop their dashboards. So it is, I think part of it is that's just the nature of GIS folk, is that that is where people go to when they need to do something. So I don't want to say there's that they trust us, but I think that they do see that there's a capability there. But I also think that it was evident that we didn't get a few things right at the beginning. And I definitely valued, the person who reached out to us was an epidemiologist in Memphis who was had been hired by the city of Memphis to lead their response. And, you know, he was really forthright, to put it mildly, in talking about some of the information that we were showing. And so I don't know that we violated the trust, but it did make me understand that although I was looking for input, the data was very limited at the beginning, and I was looking for input. But when we went from our first version of our dashboard to our second major version of the dashboard that we saw, I got a lot of feedback from people in public health and epidemiology to make sure that we were doing it right. The first time it was just like, we're just getting something out there. And the second time, that definitely changed. And one of the reasons that it changed is because the first version had the Tennessee State Data Center logo on it. The second version had the University of Tennessee logo on it. And so I wanted to be absolutely certain that the things that we were putting out there, because it said the University of Tennessee, was sound. And so that's why there's a group called Core 19 that was formed out of the Baker Center that had public health experts and EPIs in it. And they helped vet this to make sure that it was good.
I know I can keep asking lots of questions, so I'll try to be quiet.
Go for it if you want.
And let someone else take a shot. So I know for me, one thing that's always interesting is the difference between county level data, census tract data, and neighborhood data, specifically with like mosquitoes, because they don't fly very far. You know, people move a lot further. Has the idea of doing census tract or neighborhood level data on this, even how quickly was that squashed, might be another way to describe it.
It was never made available.
Yeah.
The state publishes some information on the number of new cases by zip code. And so that's out there for people to see. Even Knox County Health Department has some information about zip code level data, but they don't, no one has that data in an open format where you can just go get it. So they're holding on to that one a little bit more closely. For people, I don't know, that would just be information probably, I suppose you could glean the number of new cases and the total number of cases, but you know, there's a lot more that goes along with that in terms of the outcomes and the demographics and that sort of thing. So it's never been made available. And I think, you know, if you even want to go down to Florida and talk about the Florida dashboard, which is just go take a minute and go down a rabbit hole if you want on that one, because it's pretty entertaining. But one of the things that I've heard someone say is that one of the concerns, like the Florida dashboard, was that the individual level information was being shown, where people's identity were able to potentially be recreated, and people were able to re-identify it in the data. And you shouldn't be able to do that through these tools. And so I imagine that is some of the concern that comes out, but it's never been made available.
Hey, Tim, this is Kurt. Given the challenges that the Census Bureau had in collecting data this time, what's your confidence level in what we're going to get?
I don't know yet. There's challenges in every census, and what we're going to get this time, I don't know. The good thing is one of the good things is that had the county not been extended for so many months where you could self-respond up into October, self-response is the best way to, first off, self-response is the best way to get a response. Filling out your own census form is the most accurate and best way to make sure that everyone's counted once, only once, and in the right place. So it stayed open longer. So that gives me more confidence to about 2/3 of the people in the state responded on their own. But that left 1 million people to be visited and have their door knocked on by a census worker. And that's a lot of people. About 15% of those were handled with administrative records nationally. They didn't have to talk to them, but that still leaves a big chunk of people that had to go knock on the doors. The Census Bureau says they got to 99% of the homes, over 99%. But the one thing that concerns me is college students. And the pandemic was the result of that. And I'm not talking about the on-campus college students. There's plenty of administrative information that can help recreate who lived on campus on April 1st. College students who lived off campus, they went home. They vaporized around spring break, which is about the exact same time that their census form was coming up, and they may have never even seen it. They probably didn't respond. So one of my biggest concerns is for areas around college campuses where students were living off campus. I don't know how that's going to be able to be dealt with. And that there was a request for student information that the Census Bureau sent to colleges and universities. About half of the colleges and universities in the country responded positively with information. I don't know if that information ultimately got incorporated, but that's the one that probably gives me the greatest pause, is just the number of college students that just went home and were never able to complete their forms.
Tim, why are... Go ahead. Go ahead, Christy.
You said a couple of times that the public health was missing from this. Why is public health missing from this building or this information? Why does that?
Public health is providing input for us from the University of Tennessee. I think that probably what I was saying is that the public health may not have had the kind of focused expertise in these areas to help get things stood up more quickly, compared to what GIS people can, or people that work with data or in IT can do. But the other thing is that the people that are involved in public health haven't been through a pandemic before. They're all dead, the ones that were. So now I think they probably will be more prepared, but if the next one comes along, I think we'll have a better idea about the types of information that need to be put out for people to be able to understand the situation. And I'm curious what enrollment in public health programs does after this. I have to think that there's going to be a lot of interest generated among students to go into this field. So I think they'll be very well prepared. And that said, I think geography is a great way to deliver this information to them in geography classes.
So do you think that will change this? Public health will grow in its data and technological and geographic skills just as a result of this major event?
I think they already had good data and good skills and that sort of thing. I think that the people that are in the field of GIS and IT were just able to deliver it a lot more quickly. And in the future, that may change. And if there's a tornado, I always think about Texas. There's some GIS groups that are working overtime right now that probably had to stand up some things that weren't there a week ago. And that's just kind of our field. I think, is being able to adapt and respond to things quickly. I work in Business and Economic Research Center, but I still identify really closely with the field of GIS.
The question I had, you kind of made me think about the college students, but in general anyway, how do you avoid getting duplicate data? And what I mean by that, just to clarify, is when college students are going, you're counting them, they're in one state, but they're from another state. So how would they be counted? Because if their official residence, say, is in Tennessee, but they're going to Kentucky to school.
There is a process of deduplicating responses that the Census Bureau does. And I think it's one of those sort of dark art things that we don't get to see kind of the wizard, see behind the curtain to know exactly how it works. But, just in terms of things like, imagine if a college student responds, they put down their name and their date of birth and, their current address. And imagine there's a household that responds that has where that college student used to live 10 years ago, may have their name and their date of birth. There could be a way to deduplicate that response by thinking about, okay, there's this person who has the same name and date of birth, and 10 years ago they live with these parents, and now there's a person with a name and date of birth that lives someplace else that wasn't there 10 years ago. Why is that? Maybe that's a duplicate response, so we're going to take it away from that household where they were reported living with their parents. So there's a lot of a lot of ways that deduplication is done to ensure that there are not duplicate responses. And one of the things that happens, it's actually starting to happen right now, is something called a post-enumeration survey. And a post-enumeration survey is where census workers go back and ask, they sample households and they revisit them and they re-interview them to confirm the accuracy of the data that has been edited by the Census Bureau to ensure that they've got the right information and to be able to provide some metrics on how accurate it was. And we won't get it till I think it's next year sometime, this post-enumeration survey, but not only we'll get information so we can understand it by geography, but also by demographic characteristics, by size of households and racial and ethnic breakdowns and those sorts of things. And there can be overcounts. In fact, among white heads of households, I think those households were overcounted by something like 1% in Tennessee. And I'm just kind of it's not a thin air number, but it's not exactly 1%. In 2010, they were like 1% over in white households, but among Black and African American households, I think Black males were undercounted by 3%. And the Census Bureau, their big number going into the 2020 census was that children were undercounted by 5%. And a lot of that had to do with children living in two different households, maybe with parents were divorced or people didn't want to report that there were more people in their household than were actually living there. And so there are undercounts, there are overcounts. It's never perfect, but a lot of work goes into trying to get it as close to accurate as is possible.
And I know that with La Crosse in particular, we're really concerned with the impact that has on people under the age of 18. And so there's plenty of data within the census data you can look at where you can tease those numbers out for different age groups. So if you wanted to look at things, so, Tim talked earlier about like rates of things like per 1,000 people or 100,000 people. So we could actually do a little bit of that as well. We could look at the census tracts in your communities around your schools, and we could actually calculate, raw numbers of the people the census estimates are under 18, and then also like the percentage of the population. So we could look at potentially think about things like risk of La Crosse within your community to the specific audience we're most concerned with.
Okay, I've got another question because when you brought that up, Michael, made me think about it. We've seen maps showing where there have been reported cases of La Crosse encephalitis in all the different places. Is that information found at the data center?
Is that information what?
Found at the data center. Can I go to the data center and find information on lacrosse?
I don't think through Tim's, but you can through our Megabytes website. It'll direct you directly to the USGS link with all of the different vector-borne diseases. So not just lacrosse, but West Nile and others too.
You know, I've seen those. I was just curious if we had that information in the Tennessee data center, particularly for Tennessee, or if it was in the broader one.
Yeah, we just have that right now. It lives in the Tennessee Geographic Alliance, so the organization that Kurt and Brian are part of. It lives in their data hub. It lives in it's the exact same data. It just lives also now in our brand new Megabytes hub. And that's data that Becky primarily put together by teasing it out of the CDC website, because bless their hearts, sometimes they try to make data available and then it ends up not being super easy to use. So that's where all that data comes from, is directly from the CDC for a lot of it.
Now, one thing where you could go to talk to the state data center is come late September, we're going to get the first bit of sub-state census information. We'll be trying to process that fast and furious. And there's not a lot of age-specific information that will be released in beginning of October, but the population 18 years and older and the total population will be released. So we'll be able to calculate the number of people that are under 18 down to the block level, which may not be a level that you've worked with, but blocks are actually, you think of a city block or an area bounded by physical features like streams, railroads, roads, and so on. The population 18 years and under. So there will be some really detailed information coming out that hasn't been released since 2011. We'll be getting that later in the year.
So you could almost think about that from a communication standpoint. If you think about trying to communicate to stakeholders in your community about risk, we could use that block information almost like a marketer to figure out if we were going to try and educate the public or make sure we were reaching out to the communities most at risk. We could actually use that then to find those areas maybe with the highest concentrations of young people in them and make sure that we're getting our message out in those particular communities.
Yep.
Before we let Tim go, I did want to make sure everybody saw in the chat, Tim is always very, very generous with his time, and he does a lot to support the geography department and me in particular as part of the department. And last year when COVID first started, it dawned on me that when I was teaching my students about GIS and visualization, that I'd never made a dashboard and I didn't know how to build one. And I never taught my students how to do it. And based on what I was seeing, I was like, I think this is something that organizations are going to expect young people coming out of geospatial programs to know how to do. So there's a link in there to a Google Doc that Tim basically walked me through the whole thing to help me learn how to build dashboards. We built a couple of them. It seems to work pretty well. You're welcome to use that. The only thing you'll have to remember is that just like you have to be logged in so you can do things like save your maps. If you do this with students and you want to have them learn how to do this, they'll have to be logged in so they can do some saving.
And it's a great project because it's tied into data that's updated on a daily basis. And so these students will get to see this living thing that updates every single day after they're done with it. So yeah, Michael's understating his role in developing the lab a little bit, but we have been able to get some use out of it, and the more the better.
Well, Tim, thank you so much for your time today. I know that coming in extra on a Saturday is a lot to ask. So we really appreciate you being here, sharing what you do with the State Data Center, and in particular your expertise with all the dashboards that you build.
Thanks. I've enjoyed being here. It's a short commute back to the house, so it's not been much trouble at all. Appreciate it.
Thanks, man. Have a great rest of your day, Tim.
All right, you too. Thank you.